My mother and sister had that. My mother took badly at 36. They kept saying it was asthma. But finally she was 40. They said she had emphysema. And she died at 46. The difference from asthma is breathlessness, just walking, and simple tasks. Then one gets constant chest infections and gasps for breath. This is the description of the Alpha-1 antitrypsin deficiency. This description clearly defines how insidious and serious this disease is. The earlier the diagnosis, the better. The prognosis. That's why we will talk about Alpha-1 antitrypsin deficiency, how to spot it the earliest, and how to manage it. The main idea of the disease is that 90% of ATD, called Alpha-1 antitrypsin deficiency, is not diagnosed or misdiagnosed at an early stage because it looks like asthma. Or it looks like the person has just a weak immune system and gets colds frequently. They may have chest discomfort in cold air or during physical activity, or chronic cough which comes from time to time but is not severe enough to search for the underlying reason and is frequently attributed to mild asthma or just a cold. And a person may feel chest tightness similar to asthma flare-ups when around allergens, pollutants or cold air. Over time, the lungs are damaged and this destruction is permanent and symptoms worsen. It happens because Alpha-1 antitrypsin is a protein which neutralizes the enzyme elastase, which is released by neutrophils in the lungs. Without adequate antitrypsin, the elastase damages elastic cells in the lungs. Is Alpha-1 antitrypsin is created in the liver, and when there is a genetic mutation which is called PIS, misfolded proteins are created, it causes a low level of Alpha-1 antitrypsin in the blood, and its misfolded form accumulates in the liver, which causes liver damage also. So, in the case of AT disease, the lungs and liver are damaged. In severe forms, liver damage is also common, but in mild forms, only the lungs are involved. To diagnose AT, Alpha-1 antitrypsin should be defined in the blood if it is importantly low. Then a more aggressive form is expected with more severe symptoms.
Even if antitrypsin level is lower normal range and a person has signs and symptoms of ATD, like frequent colds and difficulty breathing episodes or evidence of emphysema on CT scan of lungs, it's recommended further genotype testing. There are 4 main genotypes. If PIS genotype, it means a more aggressive form. The second genotype is PIS form. It is milder but still causes disease. More commonly, people with the PIS mutation have lower normal measurements of Alpha-1 antitrypsin. There is also the PISM form, which is also a mutation and causes the disease, but usually milder, and antitrypsin level usually more near normal level.
And the PIM genotype is considered normal. So if antitrypsin deficiency suspected, only an antitrypsin blood test is not enough usually. It requires to confirm with, generally we measure Alpha-1 antitrypsin level if emphysema in people before 45. Also, emphysema in non-smokers occurs through the main treatment of Alpha-1 antitrypsin deficiency is augmentation therapy, which means injection of Alpha-1 antitrypsin, but it is reserved for severe. When emphysema is present and lung obstruction is measurable by spirometry. The goal is not a cure, because a cure doesn't exist, but to slow down the lung degeneration process. Other treatment approaches are smoking cessation. It's crucial, bronchodilators to reduce chest tightness and breathing discomfort, also reduce airflow obstruction, and inhaled corticosteroids to reduce inflammation in the bronchi. Antibiotics if the condition is too severe. Lung transplantation in very severe cases of emphysema. The prognosis is widely different. In severe cases, people with severe ATD can live into their 50s to 60s. In milder cases, a person can live almost their normal life expectancy.